We opted to start this session calling it shared decision making. Obviously, this is a whole thing about patient empowerment, so they are different aspects of how we can empower patients more. This is an outline which I will be going through more or less. I wanted to start with health literacy. Don't worry, I took it on block from WHO so that I won't mess it up. But in a nutshell, what is health literacy? Health literacy is your knowledge about health, about being healthy, about a health condition. It could be about medicines, about medical devices, about health supplements, about smoking, about drinking. So all those aspects which can have an effect on your health. That knowledge, then, it is very important how you use it and when to use it and how to communicate when you are faced with a decision related to your health. Għaliex, inti tista' tkun literate, tista' tkun għandek PhD fl-inġinerija, imma fejn tidħol il-health ma taf xejn. Mentri tista' tkun pazjent li għandek job normali, imma għandek kundizzjoni li tqum u torqod miegħek. Allura inti kważi ssir espert f'dik il-kundizzjoni, issir espert li ma jekkel jaqbel miegħek, li ma jaqbilx, li mu l-aħjar ħin li tieħu l-pinnoli. So hemmhekk inti you are more health literate than somebody who would be considered of a higher level of education. So health literacy u education do not always equate. U di xi ħaġa li tħawwad ħafna nies għaliex jgħidulek imma jiena ma nifhimx, imma jekk int għandek kundizzjoni kronika ilek 5 snin tgħix biha u qed jirnexxielek tkampa, you are a lot more health literate than somebody who has never experienced certain problems. So, health literacy is more than accessing websites, reading, that you follow the advice. It requires thinking skills and making the best use of the resources you have, but it also makes us better advocates, both for us individually and also for the communities we serve, especially within our patient community. Health literacy hija importanti ħafna to make informed choices. So I want to put this question. What reliable sources do you use when it comes to make your health decisions? Just keep it at the back of your mind because we're going to come back to it. So, when we are making everyday decisions, what do we use to make our decisions? GButtigieg, and mela tmur is-supermarket. Min jiddeċidi li ma prodotti tuża? Inti jew GButtigieg? X'tagħżel jekk ħadd tagħżel prodott mis-supermarket? Min ħajjażel? Min ħajiddeċidi? L-owner tal-istorja, ma ultimately meta inti tixtri oġġett, min jiddeċidi? Inti tiddeċidi. Jekk se ssifer, ma nafx, hawn ħafna min jikkonsulta TripAdvisor dwar restaurants, dwar hotels. Ultimately, min jiddeċidi f'liema hotel tmur jew f'liema restorant tmur tikol? Inti. Google jgħinna biex infittxu l-informazzjoni. It-ticket office jgħinna biex infittxu l-informazzjoni. The power to decide. Mela fej jidħlu affarijiet tal-ħajja, fej sejra holiday, fej semmur restaurant, se nixtri mill-supermarket, ħan iddeċidi jien. Taqblu li ħafna drabi fej jidħlu deċiżjonijiet dwar is-saħħa. We relinquish this control and we let health professionals take over. Does delegating decision-making alleviate us from the stress of challenging choices? Jista' jkun illi kultant il-fatt li nkunu qegħdin niffaċċjaw sitwazzjoni medika forsi ma nħossunix komdi li niddeċidu aħna u ngħidu aħjar jiddeċidu għalina. Huwa intentionally jew huwa cultural li nieħdu din l-attitudni. Il-professionals kif iħossuhom? Naf li għajmini waħda minnhom bejnietna u professionals kif iħossuhom il-professionals il-fatt li they have to carry the burden of the decision for somebody else. Because when I was planning this presentation, I thought of giving it a twofold perception. The professional and the patient. Obviously, I will be focusing more on the patient, but it was very interesting that in my search, I found more tools and more resources of how professionals can help patients, of how professionals can learn to give this power to the patients, then how patients can take this power. So what I'm gonna try to do is challenge you. So there are a lot of decision-making approaches. These are three particular ones. There is the paternalistic approach. Chris jħobb isemmih dal-paternalistic approach. Fejn the professional jaf kollox, jaf l-informazzjoni u jgħidlek dan għalik. Imbagħad għandek l-informed medical decision making fejn int għandek l-informazzjoni u more or less toqgħod fuqha. We would like to shift towards this, the shared decision making, fejn il-professional ħajtik l-informazzjoni u recommendations. Issa mbagħad inti trid tesprimi your values and preferences. I'm going to go a bit more in detail in the coming slides, but I really want you to think about this. How many times when we are given medical advice, do we actually stop and think, how is this going to affect my life? Jina minħabba xogħol niddilja ħafna ma' persuni bi problemi ta' saħħa mentali. U waħda mill-affarijiet li għajduli għax il-mediċina li jtuni traqqadni. U ngħidilhom imma inti ddiskutejt mal-professional tiegħek jekk din il-mediċina tistax toħodha fil-għaxija flok filgħodu. Għax jista' jkun lek inti toħodha fil-għaxija u torqod lejl tajjeb u mbagħad filgħodu tqum tajjeb. Mhux toħodha filgħodu torqod mal-ġurnata u tagħmel lejl imqajjem. Kultant huma affarijiet vera sempliċi, imma noqogħdu lura milli nesprimu ruħna. So, ħanurikom video, nagħtikom naqra break mill-leħni, u dan sibtu minn YouTube għandkom il-links kollha, ġifri we can share these. Mhux dal-video, imma ovvjament. Starts with the details. Awejja.
Everyone has preferences. Everything from coffee versus tea to more serious ones like buying versus renting. These preferences are particularly important when it comes to your health. For example, do you prefer to take medications which may have side effects, or do you prefer to hold off on medications to see if things improve on their own? Probably depends on the situation, right? Well, shared decision-making between an individual, their family, and the entire healthcare team helps ensure that an individual's preferences are respected and prioritized. In some conditions like breast cancer, prostate cancer, heart conditions, and back pain are especially sensitive to individual preferences. In fact, informed choices typically lead to better outcomes. Now, to make a well-informed choice, individuals need reliable information about the pros and cons of a treatment option. That can come from a decision aid like a pamphlet, video, or a website. Let's take an example of back pain. Imagine there's an elderly woman named Ramona who's been struggling with chronic back pain. She goes online and finds a variety of options, wearing a back brace, trying yoga, surgery, and losing weight, just to name a few. But it's hard to know what information to trust. Shared decision-making is a process that can help her navigate these choices with a healthcare professional. One approach is called the 3-talk model. The first part is called team talk, and it's where a clinician describes choices, offers support, and asks about an individual's goals. Ramona shares that she lives alone, but can no longer take long walks or pick up her grandson because of her pain. In fact, that's the main reason that she's taking her pain more seriously now. If she's feeling supported, Ramona might also discuss being overweight and how she gets embarrassed to have her photograph taken. The second part of the model is option talk, and it's where different options are laid out. Her clinician can give her evidence-based decision aids with pros and cons for each option. Some of these options may be more appealing to Ramona than others. She might be more inclined to work on her diet if she understands that weight loss can help her back pain. She might really not want surgery because her sister has had chronic back pain ever since she had back surgery 2 years ago. She might not feel comfortable doing yoga because she feels anxious in group classes with younger men and women, and a back brace seems like it might be uncomfortable. The third part is decision talk, which focuses on making sure that an individual's preferences are driving that decision. Ramona might decide to try and change her diet first, and then consider doing yoga or other exercises from the privacy of her home. She might consider a back brace if those things don't help, and surgery would be a last resort for her. Shared decision-making relies on an individual having accurate information and a clear understanding of their situation. And by spending extra time up front, asking about preferences, and carefully listening, the healthcare team can often uncover beliefs or assumptions that may be motivating the individual's decisions, and that can save time down the road. The fact is that clinicians are not very good at guessing what their patients consider important in making their decisions. So these beliefs have to be uncovered through a conversation so that they can be directly addressed. Ultimately, if individuals feel that their healthcare professionals understand what they want, they're more likely to trust the advice they receive. And better care leads to better outcomes.
I will be putting the links in the presentation so you can go through these at a later stage if you'll be interested. Mela. One of the approaches which I really liked, I told you during my research, was this share approach, where SHARE stands for
New Kit Kat tablets. Discover 3 exciting flavors. Have a break. Have a Kit Kat.
The #1 hair conditioner. Now without the waiter, healthy hair never felt so.
Sorry. Esterna. Mela aħna wasalna. Dejjem nagħmilha dil-biċċa xogħol. Sorry. Mela, this is an approach, a teaching approach for professionals. Għalhekk għamilta professional and patient. So, it is recommended that professionals to seek your patient's participation. So, as a patient, how can you contribute towards this? So, prepare any questions regarding your medication, test results, treatments, recovery timeline, related concerns. Have you ever had an intervention and you didn't know if you had to stay in bed for a week, for a month after the intervention? It is your right to know that information before, to ask for it. Don't be afraid to ask. Ħafna drabi llum il-ġurnata tikollna ħafna informazzjoni through our smartwatch and different apps. Dik l-informazzjoni tista' tintuża ferm tajjeb in a medical encounter, tista' tagħmel ħafna differenza. Għaliex hekk inti għandek pereżempju apps li monitorjaw ċertu affarijiet, pereżempju l-irqat, jew glucose monitoring, jew your weight, pereżempju, inti tista' tgħin it-tabib jagħtik informazzjoni aħjar jew treatment aħjar. Consider bringing a trusted companion. Kif konna qegħdin ngħidu fil-parti ta' qabel kemm importanti ħafna illi jkollok xi ħadd miegħek. Għax jista' jkun ukoll li inti tkun id-dar u qed tiddiskuti jew ma' din il-persuna tiddiskuti aspetti differenti li dak il-ħin nafu kemm huwa a clinical encounter. 8 minutes maximum, 10 forsi. So, inti jista' jkun li f'dak il-ħin inti tant tkun pressured illi laqas tajda l-informazzjoni, so għalkemm forsi l-professional qed jipprova jagħmel l-almu tiegħu. Bħala pazjenti kultant ma nkunux forsi daqshekk preparati biex ngħinu lil nfusna. Mela, help your patient explore and compare treatment options. Hawnhekk waħda mill-affarijiet li tidħol il-health literacy. Kultant bħala pazjenti speċjalment meta ikun hemm kondizzjoni tal-muni intom issiru kważi iktar esperti mill-professionals għax tkunu qegħdin tfittxu l-affarijiet. So, importanti ħafna illi aħna nkunu lesti biex naraw x'alternatives hemm, mediċini, medical devices, surgery, would be the better option for me. Choices bej fast-acting treatment u slow-acting treatment. Jiena bniedmar illa qajjebli li ħanieħu treatment kuljum jew aħjar jagħtuni xi ħaġa a bit more long-acting. Advantages and risks related with the different treatment options. No treatment could also be an option. Lest li nikkonsidra no treatment. Dawn huma kollha affarijiet li I'm sure li minix qed ngħid xejn li ħareġ minn naża l-bieraħ. My intention is to put our thinking heads on. Mela, lej, assess our patients' values and perspectives. Di ħafna drabi ġili smajna fuqha. Meta, pereżempju, jkollok persuni tal-Jehovah Witnesses illi jirrifjutaw il-blood transfusion. Ħafna persuni jgħidulek xi ġifieri tirrifjuta. If it is their belief, importanti li huma jesprimuha. Sewwa, termination of pregnancy. Sewwa, x'inhi x'naqbel magħha ma naqbilx, jiena bħala health professional I could still give the option to the patient, u mbagħad il-patient imur bil-beliefs tiegħu. Anki, pereżempju, the proposed treatment options. Does it align with my values, with my lifestyle? Billi li tgħidli, pereżempju, ħanati eżempju vera ċar. Persuna viċin tiegħi da ma jkollx ħaxix. Inutli murant tabib u jgħidlu isma' inti tittaqta' l-ġin u tikoll ħaxix biss, għax probabbli joħroġ mill-bib u jgħidlu ħanamel fattija. Jew pereżempju persuni illi illum il-ġurnata sawrqaw ħafna intolerances. Jiena naf ħafna persuni illi daw għamlu testijiet u jiġu gluten intolerant, jagħmlu forsi xarej, ma jaħlux gluten u mbagħad jerġgħu jaqgħu u jiġu jaqgħu umu jgħidulek nippreferi ikoll il-bloating milli ma nikollx. It is their choice, it is how they want, their values. Also, taking in consideration mhux just il-kondizzjoni imma your personal goals for treatment. Għaw persuni li ngħidlek anke għatawlhom qalbhom li se jkollhom xogħol, pereżempju jew li jistgħu jżommu lilhom infushom gainfully employed u xorta baqgħu jaħdmu. Ukoll quality life. I think that varies from person to person. What I consider quality life might not be what you consider quality life. So it is very important that we see both sides of the coin. reach a decision with your patient and evaluate your patient's decisions. So, from a patient perspective, it is very important that we understand the information provided. If we do not understand, we have all the right to ask for clarification and ask for further information. Sometimes, if it is possible, if it is feasible, you might consider to take the advice, go home, think about it, and go back to your health provider to take the decision. Obviously, there is a responsibility to adhere to the decisions taken, because if dik kienet tagħmilha n-nanna tiegħi. Nanna tiegħi kienet diabetic u kien ikollha ferita f'saqajja. Kienet tmur għand l-ispeċjalista jagħmilha dressing, u mbagħad tmur id-dar, taqla dressing, tagħmlu fil-friġġ u timmedika din il-ferita hi. Xi jumej qabel ma kien ikollha bżonn terġa' tmur għand l-ispeċjalista, terġa' taqbad din id-dressing mill-friġġ, terġa' tpoġġiha fuq il-ferita u terġa' tmur għandu. U ovvjament it-treatment ma jkunx ħadem, tkun għamlitilha l-bambin jaf xiex, so she took the decision not to adhere to the recommended decision. Eventualment ġifri spiċċa tempjuti, imma that was her decision. Ideally, if we encounter difficulties, we communicate with the health professional. Mela, fil-bidu għattilkom, where do we get the information from? Why? Because shared decision making depends on the right information. I know that many of you represent various groups, so there I put the link to our list of members, so that because I know many of you provide training, leaflets, and relevant information about the conditions, and I've learned much more from patients than from Dr. Google. And the last thing, I put a link to the Patients Academy, which is being promoted by IAPO. In fact, I'm going to close with a video from the Patient Academy site. And within this site, there is valuable material, even on various conditions. Obviously, there isn't about everything, but the videos and the material that there is very relevant, very simple, straightforward information. You can use these freely. Issa nispera li jaħdem. Għax l-ewwel ma ħadimlix. Attara, okay.
What is shared decision-making? SMD. Shared decision-making is a collaborative process that involves a person and their healthcare professional working together to reach a joint decision about care. SDM involves a two-way exchange between the patient, who provides insight into their goals, values, and preferences, and the clinician, who outlines the benefits, risks, and uncertainties of various care options. Engaging people in their health and care is a key component of developing a healthcare system of the highest possible quality, one that is safe, effective, and person-centered. The process of shared decision-making may include identifying the issue, identifying potential solutions while outlining the benefits and harms of each option, checking that patients and healthcare providers have a joint understanding, agreeing on a course of action, implementing the chosen treatment, arranging follow-up, evaluating outcomes, and assessing next steps. Shared decision-making can be appropriate for decisions about whether to undergo a screening or diagnostic test, undergo a medical or surgical procedure, participate in a self-management education program or psychological intervention, take medication, attempt a lifestyle change. Goals of care are things you can do to have good health. For example, your goal might be to lower your blood pressure, walk with no pain, walk upstairs. A healthcare team can help you make your goals a reality. Your healthcare team are the people who help manage your healthcare. For example, carers, doctors, nurses, other health experts like pharmacists and physiotherapists. Tips to plan your goals. Think about what is important. To work out what is important, you can talk to your family and carers about what you need and what you want to get out of care. Remember to ask your healthcare team questions. You can ask for information about your health problems, health tests, treatment options, side effects. This means what can happen after a test or treatment, costs. Plan the right goals. Choose goals that are positive and achievable. You can write about your goals to check if you have met them. It is okay to change a goal or think of a new goal. Your goals might change because your health problem changes, our treatment does not work, or a different goal is more important to you. Throughout your health journey, remember to ask your healthcare team questions about shared decision making.
Aħna full members tal-IAPO li hija l-International Alliance u fil-website tagħhom hemm ħafna informazzjoni. I encourage you to visit the site. Ma nafx hekk għandkom xi questions jew any questions? Christine?
Kumment, u nixtieq nabina mal-ħadida li kellna fuq patient safety. Typically għal dan affarijiet, itkun hemm dedicated time. Mhux 4 minutes għal barra.
Yes.
Jiġifieri tipo li s'issa tkellimna fuq il-healthcare professional, il-actual healthcare provider u l-pazjent. Ma naħseb tkun hemm involut l-awtoritajiet li they allow for adequate time biex da jsir għal-ġid tal-pazjent fl-aħħar mill-aħħar safety tal-pazjent.
Yes, definitely. U anke wkoll li jkollok better outcomes milli li jkollok repeated visits għax ma jkunx ġew exhausted.
Hello, Christine, MS Society. Għada bħala MS Society ma nsaqsu għal MS Nurse. And the aim of the MS Nurse is precisely biex tista' the patient has got a center point. So you talk about a patient taking a friend, or for example. In reality, u anki barra minn Malta tirrealizza, li mhux kulħadd jista' jil-pazjent imur miegħu, farli jew friend miegħu. Allura, dik l-MSS would be the center point, bringing all this team together. Through experience, because we don't have an MSS, I have had to build my own team. This interfuq, and sometimes having to go through private appointments, biex nista' nieħu dawn l-opinjonijiet, and then make my own decision, an informed decision. I can understand what you're getting at, imma I'm afraid għandna naqra lose.
Yes, Frank?
L-istess ħaġa kontu ngħidlek. Specialized nurse.
Specialized nurse.
Mhux għall-epilepsy biss, biex tkun bridge in between.
Fil-cancer fejn għandhom il-navigator nurse, sabuha ġifieri kienet l-aħħar li kien hemm xi ħaġa tal-cancer minn għalija kien Pariġi l-Ministru, ġifieri kienet waħda mill-affarijiet li toħlu fis-servizzi tas-saħħa navigator nurse fil-cancer. Ma n-nies ma jmerdux biss bil-cancer,
As a matter of fact, dipartimenti oħra materjali li għandhom in-ners speċjali għalihom, jew il-lab speċjali għalihom, fejn anke il-pazjent jew il-familja tal-pazjent jistgħu jċertu biex jieħdu ċertu riżultati li jiddiskutu ma' minnu what the next step would be. But yet, there are other departments like ħan nitkellem għalina MS, fej we are still without a nurse. Jiena tħaltu il-biċċa xogħol about 14 years ago now, specifically to get a nurse, and I'm still having problems.
We keep pushing.
Yes.
Nixxerja xi ħaġa żgħira, which is not a joke, but it's funny. This sharing decision ila darba niftakar dan tabib mal-mara ġiri kont immur biex xed intuwa. That's sharing, qed tisaqsi lili x'mediċina ġifieri jiena ma kellix in-noti jew irid inkun noti. Seta' jew nagħmel sball. Ġifieri tabib ma kellux in-noti x'kura trid tisaqsi lili. So that was a typical sharing decision in the wrong way. Probably it happens.
Mary, President tal-Aram, nishtiq inkopli fuq Christine li għalet il-ħin. Issa aħna meta mmorru decision making u niddiskutu ma' tabib fuq il-mediċina. Imma naħseb li l-professionals il-tabib irid jara wkoll il-persuna bħala holistic. Ġifieri mhux il-marn biss, irid jara x-xogħol, is-sitwazzjoni tad-dar u l-krivu kollox. Naħseb li għandha ssir.
il-healthcare professionals kollha anke dawk li m'għandhomx il-xogħol għandu jkollhom il-mindhealth trainers. Jiġifieri din xi ħaġa u fuq il-mindhealth għandu jkun hemm kollox. Jiġifieri anke jekk tabib qed jara prejjem naħseb wasalna biż-żmien li nużaw ħafna l-information technology u tibor jkun hemm kollox il-situations kollha.
Issa rispondi ma li għadi to be fair, għax imbagħad irridu nirrispettaw il-patient privacy. U dik is-sistema taħdem li l-pazjent jagħti permess lila bħala tabib, lilu bħala tabib. Ġifieri li mhumiex all inclusive il-information li hemm naqbel miegħek perfettament, ma inti qed tissuġġerixxi li jkun open għal kulħadd.
Imma tkun iktar xi ħaġa holistika li jekk il-patient jagħti ċertu share il-platform.
Sabejna fin,
l-aħħar session ħajkonna ħatkun February, ħatkun fil-mindhealth u digital tools.
Nistgħu niddiskutu
iżjed fit-tool fuq.
Minn min proġetta.
Hi Gertrude Joseph, edha membru il-Komitat ta' Caritas Modern Association. Jina għandu domanda, ma nafx samil xtensa. F'każ fejn il-pazjent huwa minor jew li mhuwiex kapaċi jesprimi l-lu. Per eżempju, jien qed nitkellem fuq it-tifel tiegħi li huwa 4 years old. Il-minuta li nidħlu għall-viżit, tat-tifel jiġi stressed beyond means. U kważi iktar jiġi judged fuq dak l-stressful period rather milli assess nidħol bil-notes jiena datu hekk, x'huma sintomi kif aħna għaddejjin. U kważi iktar nħossu li jiġi judged fuq dak il-ħin rather than l-informazzjoni li qed ngħaddi jiena bħala il-primary care tiegħu. Ma nafx jekk tagħmilx sens li forsi it-tfal li huma minors u mhumiex kapaċi jitkellmu għalihom infushom, forsi għal dawn ir-routine checks ma jkunux preżenti. Ma nafx kemm tagħmel sens.
Ngħidlek da xejn diffiċli għaliex inti tabib huwa marbut illi jrid ikun għamel medical examination per eżempju biex jagħmilek prescription, jiġifieri mhux forsi repeat prescription, jew biex jirrekomandalek ċertu testijiet. Jiġifieri inti anki ċertu formuli, per eżempju, hemm kif għatina naħdem fil-mental health, hemm ċertu applications. Jiġifieri tabib, I certify that I have assessed the patient. Jiġifieri.
Allura ħadd hemmhekk nerġa' tidħol l-importanza tal-effettiveness li forsi dak ċertu xogħol isir minn qabel. U forsi il-patient ma jkunux daqshekk exposure.
Komunikazzjoni ma' forsi anki professionals fil-komunità illi forsi pereżempju hekk inti GP regolarment id-dar illi t-tobba tal-isptar jistgħu jikkomunikaw mal-GP. Li kollok dawn għax forsi kif tajtin tabib li raf fl-ambjent tiegħu id-dar dat tifel li wara l-ex. Jekk inti mort l-isptar diġà it-traġiet, it-traffic il-ħin tistenna. Sowa, ġifieri dawn jista' jkunu affarijiet li we build in our recommendation policies. Ħajkolli nagħlaqgħu għax inkella se jkaċċuni. Nistiden il-Professor Cinongilot, l-għola t-ringrazzja, Professor li għaċċettajt li tkun maħna l-lejla, u we look forward għal-presentation